Welcome. My name is Laura Ferguson. I'm an assistant professor at the School of Preventive Medicine, and I am part of the program on global health and human rights in the Institute for Global Health, and it is with great pleasure that I welcome you today to this quite exciting panel. The panel is co-sponsored by the program on global health and human rights, the Institute for Global Health.
Can you put your mic closer?
Really? Is that better?
Yeah.
It's on.
Oh, it's not on?
It's on.
It's on.
Can you not hear me?
It's better.
Yeah.
Okay, this is kind of a funny way to start.
There you go.
Let me try. It's hard as my coffee.
You can go anywhere you want.
Okay, is that any better? No, you still can't hear me.
No, it's not on.
It really sounds odd to me. Okay, I'm going to try. Our co-sponsors, Program on Global Health and Human Rights, the Institute for Global Health, GlobeMed, and Occidental College, so thanks to all of them. I will shortly hand over to John Hellman, who's going to introduce the event. I was given the task of providing a short introduction to him, which is in fact quite a difficult task given his very long list of accolades. But I will try to keep this brief. Professor Hellman did his law degree here at USC. He teaches here and at Southwestern College. And he also has a very prominent career as an elected official. He's been a city council member for the city of West Hollywood since the city was incorporated in 1984. And he's also served as mayor of the city on no fewer than 7 occasions. He's a past board member of the American Civil Liberties Union of Southern California, past president of the Gay, Lesbian and Bisexual Local Officials Group, and past co-chair of the International Network of Lesbian and Gay Officials. So I can think of no one better placed to introduce this panel. Please welcome me in joining John Hellman.
They'll be able to hear me, right? It wasn't the volume, Laura, it was the accent.
There's a lot.
Thank you for that wonderful introduction, and I appreciate all the accolades, and I want to especially thank my colleague Sophia Greskin for bringing us all together and organizing this program. I want to thank the co-sponsors as well, the USC Institute for Global Health, the GlobeMed at USC, and the Program on Global Health and Human Rights at USC, and as well Occidental College for helping to bring us all together today. As Laura said, I have been an elected official for more than 30 years now, and when people say really nice things about you, it usually means you're dead. Because being in local office isn't always the easiest thing to do. But before I went into local government, I was a student here like some of you. I was studying at the law school and wondering what my future was going to be and wondering what opportunities there were for people who were openly part of the LGBT community. And at the time, there didn't seem to be as many opportunities for me as there were for other people. And I've subsequently come back to teach, and I've studied a few other things while I've been working, but I always remember my experience back here and the transformation that I've seen in the legal profession, the transformation that I've seen within the body of elected officials. When West Hollywood became a city in 1984, I was fortunate enough to be part of that group, and we decided to convene gay and lesbian elected officials from around the country. It was easy. There were only 10 of us. So we got together in 1985, and the transformation that has occurred has been really dramatic. When we first became a city, there were all these questions. How will these gay people run their city? We weren't predominantly gay, but we had a majority of the council that was openly gay. We had, as I said, very few elected officials across the country. No one openly gay in college, or in Congress rather. So the transformation has been very dramatic among elected officials. I remember in the early days when we adopted domestic partnership legislation, and that seemed like such a radical idea to allow same-sex couples to register and get some kind of governmental approval. Of course, now we have marriage equality in the United States, and that's just been really, in the big scheme of things, a very short period of time. As we're looking back historically, we should also remember that history continues to evolve and change continues to occur. Right now, I think we have this notion that progressive organizations like ACLU, like Amnesty, like the National Organization for Women, that they've always been on the side of LGBT equality. But in fact, that hasn't been the case. That progressive organizations have had to go through the same transformation that the rest of society has gone through. Fortunately, there are organizations that have gone through it quicker and earlier, and they've been able to provide leadership. And reflecting back over the last 30 years, I just know how important it is for organizations like Amnesty, ACLU, other progressive organizations to have gone through that transformation and to become advocates for LGBT equality. It influences what governments do. And by the same token, what governments do influences NGOs, influences the private sector. If you think about our fight for marriage equality and fight for equality for LGBT people in this country, it's become a lot easier when you have progressive organizations on your side. It's become a lot easier when you have corporate citizens and business entities who suddenly have adopted the mantra of LGBT equality. And to some degree, that's in part because some governments and some nonprofits have demanded that level of equality from those entities. So I really appreciate the opportunity to be here today. It's given me an opportunity to reflect a little bit on the transformation within my own community, the transformation within the broader LGBT community, and certainly the progress that has been made in the fight for global equality. But as we listen to our great panelists today, I hope we'll recall and remember that how fortunate we are to have made the progress that we've made, but there are a lot of people in the world struggling for just basic recognition, basic freedom. And I hope we'll take the lessons we learned today and use them to continue that fight around the globe. So I'm going to turn it back to you, Laura, with your wonderful accent. And thank you all for being here.
Thank you. Thanks, John. Okay, so I realize I'm the only one with the accent, but I'm going to do the least talking at this table. We have for you here a panel of visionaries and luminaries. No small introduction. They have all been working at the forefront of efforts around LGBT rights for probably longer than they might want me to mention. They came together in many ways around work to ensure that Amnesty International took on lesbian and gay concerns, forming a group that was fondly known as AMLGUC, which is Amnesty International Members for Lesbian and Gay Concerns. I think it's also really important to mention that they're a very tight group of friends. And I think that's important because I think that the trust and respect that they have for one another has really helped inform the work that they've done collectively and individually over the years. And so I think that's a really important part of the story that I don't want us to leave out. So what I'm going to do is give a 2-second introduction to each person and then ask them to add to that themselves, really giving us a sense of how the group came together, so how you met one another. And I know that we have not too much time, so I'm going to ask you to try and keep that brief. Let me start here. Next to me is Ali Miller. She is professor and co-director of the Yale University Global Health Justice Partnership. Ali, welcome. Can you give us a sense of how you met any of the panelists here?
Sure. So I was actually working as a staff person at Amnesty International in their national office starting in I had been in the London office in 1987 and started working in their national office in 1988. And Sophia Gruskin came as my legal intern in the summer of, I think, 1989. And we were doing the background research on what was the pattern of law and human rights practices around same-sex sexual conduct. And she connected me with the ACLU. And then Meg Satterthwaite was a college student at the New School, and she, because Amnesty does a resolution process, a membership-based resolution process, and she walked in with a college student resolution on lesbian and gay rights. And Cynthia was a part-time or staff person in the Boston office of Amnesty, and she was in the first regional conference where we presented that resolution. And Susanna Fried and I had worked together in preparation for the World Conference on Human Rights, actually around women's rights, because this was a time when all of human rights was opening up as a conversation, post-Cold War, and women's rights, gay rights, health as a human right were all coming together as a conversation.
Fabulous. Thank you. Now you know the whole history of how it came together. There's left nothing for anyone else to say.
That was always a problem. Fred, over to you.
Okay, I'm going to just keep going down the line. Meg Satterthwaite is a professor of law and director of the Center for Human Rights and Global Justice at NYU. Meg, is there anything you would like to add to that part of the story?
I think, Ali Miller is the hub from which all of us folks emanate. But it is true that I met her as a college student, and I don't think I'll add anything else to how I met everyone, except to say that I definitely met all of these folks in a position of vulnerability, and that they were wonderful mentors. But also, we're really good at identifying how maybe misguided and naive thinking could be channeled into something productive.
Thank you. Next down the road, Cynthia Rothschild is an independent consultant who's recently done a lot of work with the Office of the High Commissioner for Human Rights at the UN, but has also worked with a lot of different NGOs on issues around sexuality and sexual rights.
Also not too much to add, other than to say that, given all of our entry points into the project that we'll talk a little bit more about, which really was pushing Amnesty from the inside to do work that we really believed needed to happen in the face of torture, death penalty, many different kinds of violence. We, I think, are very lucky in that we came together at the right political moment with the right mandate, so to speak. And I think we were part of what feels in retrospect and probably currently like a significant political project. There were others who were not at this table. We're sorry that they can't be here, but yeah, it's been a remarkable journey.
It's not over yet, Cynthia. Next, Susanna Fried is a visiting fellow at the Yale University Global Health Justice Partnership. Until recently, she was the senior gender advisor at the HIV group in UNDP in New York.
Good morning, everyone, or afternoon. So I entered this part of the story somewhat later than the rest of the folks here, though I'm not younger than them. I had been doing work around women's rights and LGBT rights since the early 1980s, and in fact came to Amnesty through the human rights work, as Ali said, that we were doing around a series of world conferences of the 1990s, starting with the Environment and Development Conference in 1992, and then 93, the World Conference on Human Rights, where Ali and I were part of a group that was that had come together as part of the global campaign for women's human rights, that we were actually preparing a series of fact sheets, and in particular, we were working on the fact sheet on lesbian and gay rights, which is what we were talking about then. And then somewhat later, I joined Amnesty as Emil Guk was turning into Out Front, and as a number of these folks, having done the work for a long time, were feeling very ready to see a new crop of people step in. So I became part of it actually during the period where Emil Guk became Out Front and actually became more institutionalized within Amnesty, both in the US. Out Front was the name, and so it turned from a membership group to an actual program of AIU, Amnesty USA, and actually became a program at some of the other Amnesty sections, and Amnesty section is the national group. I'll stop there.
Thanks. Last but not least, Professor Sophia Bruskin. She is director of the program on global health and human rights. She's a professor in the law school and the medical school here at USC.
Okay, well, I was Allie's intern. We all did that. And I think that was super important. And after that, I think what was really important was the work that we had all started doing went on way past the internship. And so the internship was one of those formal 6 hours a week or 10 hours a week or whatever it is. But it was the work in the evening that mattered, and it was the work that we were all doing at that time that was really important. And then when the internship was over, it wasn't like it wasn't even over. Like at that point, once the internship was done, then all of a sudden it was 20 hours in the evening, right? And then all of a sudden we were working weekends, we were working nights together, and collectively, the other thing I have to say is that at that point, I lived in the East Village, and my apartment was particularly useful because it was kind of closer than everything else. So we tended to use my apartment as the place where we met, and I have to say my apartment was really tiny. And there were a lot of us kind of in that space, and it feels like one of those things when you have this image of kind of a bunch of people kind of grouped in this little tiny room like you can only have when you're like 22. Okay, so.
Okay, so there you have our panelists. Let's jump straight in. And Meg, if I can I start with you and just ask you to set the scene. I mean, you've all worked together for a long time, but it really did seem to start with the creation of Emil Guk. So how did you guys see that there was a need for that, and sort of how did that come into being?
Great. So as I said, and as everyone has said, I was a college student at the time. And Amnesty International really is a membership organization governed by membership. So you can actually change policy by bringing a resolution at a regional conference if it passes going to the national, et cetera. So I had found out about Amnesty's policy on LGBT rights by essentially having been an Amnesty activist and discovering that, for example, at the time most of the work was around prisoners of conscience, who are people who should not be in prison, that Amnesty would campaign on behalf of and call for the release of people who were imprisoned for gay rights advocacy, but not who were imprisoned for being gay. So this seemed really absurd to me, and as a college student, I decided to write a resolution. Well, of course, this was a naive thing to do because I didn't first investigate what had already been done within Amnesty, you know, the sort of things that those of us who do this kind of work now would start by doing. But happily, Cynthia working in the regional office and Allie Miller working in the national office were sort of brought to me. So they kind of helped me understand that it would be helpful to realize that there were people inside who had been working on this for a very long time, and that maybe this resolution, X number of times, had already been passed at the US level, and the issue was more international organizing that was needed. So they helped me recraft it into something that created a task force, which I'll get back to. So that all was going forward. At the same time as the kind of resolution process happened, I realized that there was a lot of internal stuff going on within Amnesty. Just getting up and sort of having to talk and advocate for this resolution, and hearing the questions that Amnesty International members had. I mean, they were questions, for example, if we change this policy, won't we have to advocate won't we have to advocate on behalf of pederasts, on behalf of, I mean, it was really like a classic old kind of homophobia. Mm-hmm. So it became clear that we needed a lot of sort of education of Amnesty membership, and then we also needed connections to the LGBT movement officially and organizations, because the next question that would be asked is, come on, there are no gay people outside of the West. Why do you want to do this? This is colonialism, et cetera. So that was the reason. Just to go back to the task force, so what we ended up doing, thanks to these guys, was passing a resolution that created a task force that was really going to look at the policy level set of issues that needed to be addressed. And it was called the HIV Homosexuality Task Force, or as we like to call it, the HIV Homo Task Force. And I think I'll leave it to others to explain sort of why was that the strategy at the time.
Thanks. Does anyone want to add to that?
I can jump in on that. I can jump in on the HIV Homo Task Force. So at that time, HIV was a gay disease. And so that was the language, right? And so if you were going to look at HIV, the only way you could conceive of looking at HIV was as part of thinking about homosexuality from the perspective of amnesty. And within that, these two issues clearly went together because they were talking about the same people. And what's important about that is the fact that that meant that homosexuality really meant gay men. It didn't mean lesbians. It certainly didn't mean transgender populations. It really meant gay men. And so the idea that was that we were in this HIV Homo Task Force working around these issues. And what's important, I think, about that is the way in which collectively it didn't strike us as wrong at the time. You know, that was the time, right? And so we recognized that we were needing to make political choices to put these things together, but none of us had the kind of critique that I think all of us have now to look back and say, my goodness, it's incredible that we did that like quite a bit that way, right? So, all right.
You go.
Yeah, let me I'm not going to speak directly to the HIV homo piece, but I think Ellie may want to come back to that. But I do want to say that at that time, it felt as if we had a knowledge of a human rights truth, and that was about the abuses and the murders and the stories that we were hearing in our lives. And this was a project about how do you move a bureaucratic human rights institution with your own sense of truth, and and I don't mean that in a moralistic sense of truth. I mean, we were hearing stories about social cleansing and people being targeted in XYZ countries. Obviously, within the United States, this was taking place in those years between two very significant Supreme Court cases, right? One which upheld sodomy laws in '86, and one which struck them down in 2003 or 4. So we're right in the middle of that. And that's informing the context of how we're thinking and why we're aiming to do this project.
Thanks.
All right.
But part of what I wanted to jump in on in terms of the point of creating a task force on an institutional side was to create a mechanism by which the organization would be forced to keep learning, right? Because otherwise membership activity can rise and fall. And so we wanted to build an institutional obligation to keep learning. But it's that moment at which kinds of knowledge, and here I'm talking about knowledge within both law and human rights and the knowledge within health, in 1988, in 1989, 1990, which is this period in where we're pulling all this together, was in a very different place and space, right? So around the human rights world, the world of human rights had not addressed, not the international institutions of the UN, not elsewhere, tiny pockets in WHO, right? When does Jonathan Mann come into the 87, right? But if you think about it, so in that same time period, actually a little later, but just in 1980, 93, 94, I worked on a petition to the Working Group on Arbitrary Discrimination, which was one of the preeminent working groups on human rights in the UN. Classic human rights abuse, arbitrary detention, classic human rights abuse. And we did a petition in regard to the HIV positive Haitians who were being held on Guantanamo. Just hold on to Guantanamo, right? Because the US certainly has. But so the HIV positive Haitians held on to Guantanamo being arbitrarily detained based on no valid health reasons. When we broke that, we actually relied on Sophia Gruskin because mainstream human rights lawyers like me knew nothing about health and human rights. We brought that to the working group and they said, what do you mean it's not justified? Of course an HIV detention is justified on human rights terms. So the amount of educating that we had to do within the formal, this was the UN, right? Within the formal human rights system around a disease which at that moment was fatal, right? For all people, and was incredible. So kinds of knowledge and kinds of, the other thing I want to talk about is kinds of blindness. So one of our colleagues, when Cynthia talks about the connecting across where there are social cleansing, one of our colleagues, Pablo Ordóñez, working in Colombia, had reports of people, mostly transgender, but gay and trans identified, being killed by death squads. Now that's a classic human rights abuse. Amnesty should work on it. But because they were gay and transgender, often people in sex work, they suddenly became invisible as human rights victims. The bodies were there. The police were the abusers. It's a classic human rights problem, but they could not be seen because they were somehow outside the pale. So that's the world in which we were working.
You're so impossible to moderate. You know, like one sentence.
I wanted
One
to-
sentence.
Two things. One is the resolution that finally passed, despite what's been said, the resolution that passed at the international level in 1991 actually used the broad language of sexual orientation, not the narrower language that this was framed into. And then the second thing, and maybe we can come back to the ways in which work on HIV and work around sexual orientation and gender identity have continued into the present in a very dynamic relationship that have allowed both to get pushed forward in ways that have been really important.
Okay, thanks. So I'm actually going to pick up on that. Well done, thanks. Let me pick up on that point, which is a point about language and entry points. It's also something that you raised, Ali, that this really seemed to fall outside as the way that people were understanding human rights violations at the time. And so there was this new kind of emerging discourse of health and human rights. And I wonder if you can speak a little bit about like how that evolved, what the value was of using health as the context and the discourse within which to bring attention to these rights violations, and how you think that may have changed kind of over time. And I'll start with you, Ali, as you brought it up, but I have a sense that others might wish to add to this as well.
Well, and I mean, much of this I could defer to Sophia, but I'll give my leap in, which is that partly, as I had mentioned, you know, in the post-Cold War moment, the notion that a wider range of human rights could be on the table as state obligation and as understanding that violations were not just created by individual to individual, but systems and had population effects, was sort of open as a point of exploration. And health moves into that. At the same time, all of us who've been doing work around gay rights and, you know, looking at, understood that health as the place where we could take away the demonization of homosexuality as a perversion and talk about the need for practical effects to stop a disease which had health effects and which could be stopped with health interventions or use of condoms and information and education. It was a way of moving into a conversation which within every place, time, and culture had been heavily moralized, right, and is still, and for many of us, still a moral issue, and moved the health discussion as a way of opening a conversation about diversity of sexual practices. Bracket this for a second, and remember that although it was associated as a gay disease, it was also a disease of heterosexuality. And one of the interesting questions around making sex visible is how hard health still has a hard time working against the morality of heterosexuality, which is understood to be a seamless practice, right? Somehow you can use health to open up non-traditional practices, non-normative practices, but it's very hard if you think about the rates of HIV risk among young married women, right? So health has been this site where we could demonize, but here we have this other kind of paradox. I think it was Cynthia found, or you had found, Meg, the history of amnesty, right? The Dutch section. Do you,
Oh, sure, yeah. So, I mean, one of my jobs actually back in the day was to give a little history of homosexuality within Amnesty. And one of the earliest times that Amnesty started to talk about this was that the Dutch section proposed a study on homosexuality, which they farmed out to a gynecologist to write about, was there a relationship between homosexuality and human rights? And this was really, it was 72 or 73 that this was done.
that comes out of a long line, right, of European progressive medical traditions of studying homosexuality, whether you want to go back to Ulrichs or Magnus Hirschfeld, this whole line of the medical approach to homosexuality as a way of removing it from craziness, perversity. So that was the progressive tradition within many of the sections that we were working with. So the notion of coming in and saying, actually, we don't want a biomedical explanation of homosexuality any more than we do a biomedical explanation of heterosexuality. But HIV as a disease gives us a space to talk about this incredible variety of sexual practices, some of which are same-sex. That shift was really one that we were basically, if you think about, queer theory, was being built at the same time that queer theory was being built. And so we were all, I think the reason I'm stressing this in a school is because it's that moment where scholarship and practice are actually mutually connected. We're building these things together and trying to make it make sense to a policy and very law-oriented human rights organization.
Yeah, I wanted to add a couple little things. I mean, one thing I wanted to add was that it really needs to be said how resistant human rights organizations were to working around these issues. And not only Amnesty. Amnesty being a membership organization was one where membership got a say. But all of us can tell stories of organizations, some of which no longer have the same name, some of which do, with a range of different organizations where we try to make the claim as to why it is that these were issues that they should be concerned with, and why what we got back was, we're really busy. We're really busy. Human rights, there's a lot going on here. And yeah, that's probably true that those are issues, but, this really isn't really kind of priority issues for us. So I think one of the things that was interesting about HIV is it started to open the door for how it is that organizations started to listen. Again, and I want to be very clear, in a very particular context, talking about men who had sex with men. Right? But the reality was it started open the door, but one still had to make some sort of opening. So for example, I got hired by Amnesty International in London, and when I say hired, I mean that literally I was allowed to do the work and they would look at it, okay, in London, to be able to prove that there were people who were living with HIV who were affected by the kinds of human rights violations that Amnesty cared about. And that if I was able to show them, and they needed numbers, okay, if I could show them numbers, that at that point it was something that could start to be conceptualized as something that they would start to be able to think about. And likewise within that, I also want to be really clear that health organizations, there was a really there's a funny schism here, because on the one hand, health organizations were open in some ways, but they were also afraid of human rights, kind of muddying what it was that they were going to do. So when you think about kind of strategic partnerships, and you think about institutions and organizations and what it means for people to be able to work together, I also want to say that it's not clean on the health side either, in terms of what was being done. I could say a lot more, but I'll stop, because Laura's giving me that look.
So I wanted to just kind of carry this, the relationship of kind of mutuality and tension into the future, into now, where there continues to be a really important relationship between work around health, particularly HIV, and work around sexual orientation and gender identity, in part as a way of addressing resistance. So on the one hand, if we think about the international policy level, to the extent that issues around sexual orientation and later on gender identity and gender expression have entered into debates around women's rights, which they have for, kind of back to the first UN World Conference on Women in 1975, there has been the response and the pushback has been absolutely immediate and nearly draconian. And so while all of us here and many others have continued to raise LGBT issues or sexual orientation and gender identity issues in the work of our women's human rights advocacy, it's been very, very hard to get traction. And from the moment that those issues were raised and the connections were made, the countries that feared and opposed that immediately coalesced, including with the Holy See, which is the political arm of the Vatican, to quash that discussion. So the world of health, and again, particularly HIV, has been an easier place to make the argument, in part because of the epidemiology of the disease and you know, kind of over time, you know, whether in the US or, you know, I remember doing advocacy in Kenya, where the only part of that government where there was room to talk about sexual orientation and gender identity was in the National AIDS Authority, because it was clear that men who had sex with men and trans people were amongst the people at highest risk of contracting HIV. So it's continued to be both a good and a sometimes problematic way to raise the issues. And the final thing I wanted to say is that, in fact, the first UN negotiated document that used the language of lesbian, gay, bisexual, and transgender was within the world of HIV. It was the coordinating board of UNAIDS, the UN Joint Program on HIV, and I think that was in 2008. There was actually a negotiated resolution that used that language, but the rest of the world of UN policy also kind of sets that completely aside and, you know, in effect, doesn't let that affect what happens in other negotiations.
Cynthia, you twitching?
No, I'll save you time. Go ahead. I mean, lots to say, but go ahead.
Okay.
But you buy me a beer later for $4.50.
I guess I'm really struck by all the challenges that you're articulating in terms of the different groups that have provided some fairly strong resistance along the way. And I want to go back to the time of the creation of MLGO, but also moving forward. How radical have these issues really been? How much did you feel at the time that you were breaking new ground and doing something that was considered radical? And how much was it, I guess, surprising to you that the amount of resistance that was there and the ways in which that was manifest? And I guess, Suzanne, I'll put that to you because you brought that up.
Well, you know, again, to kind of both broaden and then narrow in, and Allie made reference to this, you know, despite where social movements were at the time, human rights organizations in the early 1990s not only had a hard time dealing with issues of sexual orientation and gender identity, they also had a hard time dealing with women's human rights and recognizing that there was specificity to women's gendered lives that the human rights universe really wasn't taking account of. And so, you know, that kind of 1-2 punch was really quite radical within the world of human rights, despite the fact that at that time there had been many decades around the world of a women's movement and of a lesbian and gay movement. So, you know, there was this kind of bifurcated reality. So that's one thing, but the other thing is that even kind of, again, moving forward to when I joined AMLGUP in 1996, and it became a program of AIUSA, that kind of being given the legitimacy of being a funded program didn't mean that it canceled out all the resistance. You know, I kind of think in particular that one of the things that Outfront tried to do was actually to do the organizing work somewhat differently. So whereas the traditional way that Amnesty did its work was with Amnesty members, and that's so if you did kind of community work, you did community work with Amnesty members, and Outfront kind of felt like there's a huge gay and lesbian and increasingly bisexual and transgender community in New York City that we really need to be connecting to as part of our work as a global organization. And so we kind of structured that community work differently in response to who the community was, who we wanted to be speaking with, and actually faced a lot of resistance and pushback on that too, which wasn't specifically the LGBT part, although in fact it was really related to our sense of how you engage in this work in an integral way.
Sincere then clear.
Okay.
And perhaps others.
Maybe, just maybe. Okay, so I'm going to jump in first with a reminder that at this time, in addition to this taking place in between those Supreme Court cases, and I think Susanna alluded to this, when this is also a question about how does a group of people that comes together very informally within an institution attempt to access resources. So this is also in a moment when we're churning out newsletters in our kitchens. We're in between churning out the newsletter, on paper that we probably stole from somewhere. And in between that and the first grant that we got in '98, which was, I think, a $350,000 grant, right? So we're sitting in that time. And I think initially we went from having no budget within Amnesty to, I think we were given 3,000, 5,000 in '96. In '91, it wasn't 3,000?
That was in my house.
Okay, it was in her house. She was the money launderer, okay. So that's part of the context. We're a small group of people, although there are certainly others, again, some of whom are not here today, but there are other people in the US, and we're finding out increasingly about other people who are doing amnesty work outside the United States with similar areas of focus. And this is early email days too, right? So we're trying to figure out how to build camaraderie and solidarity across borders. We have, $5,000, which was certainly helpful. However, we had to carve out every entry point, whether that meant workshops at conferences, doing membership education, working directly with staff in the United States or staff at Amnesty's headquarters in London. We were trying to do policy work, we were trying to do membership education, again, from nothing, basically, except knowing the truth. And the resistance that we met, coming back directly to the question, we met resistance for different reasons. And there was the allegation, the more homophobic allegation that, for instance, AI will lose credibility if it begins to take a stand on these issues. And we had to really drill into people's heads. What are you really saying? Are you saying that the application of the death penalty or torture or social cleansing or the impunity, police brutality, are you saying that all of these things don't matter because of the identity or the sexuality or the sexual behavior of particular people? We had to spell out some very, very basic arguments. So there was that question about credibility. And again, we're talking on an international level, all right? So within the United States, we've had more leeway for so-called liberal responses than was probably true in other places. But we met also resistance on an institutional level with ally staff saying, you know what, I'm overwhelmed and I don't have the resource, I don't know how to integrate what you're talking about into my work. Show me how to do it. And there were plenty of times that each of us worked with individual staff people, let's say, I'm making this up, the head of the refugee program within Amnesty, or death penalty work, or whatever it was. We had to say, look, this is how this applies to issues of sexuality and sexual orientation and gender identity. This is how it applies. Integrate it into your work. We're not asking for miracles yet. We were asking for miracles later. So there was that kind of institutional resistance as well. And I also think that one of the important pieces, and Meg, I think you flagged this a few minutes ago, there was this question about cross-culturally what it meant to really be talking about lesbians and gay men, literally and figuratively. There's a language issue because in most cultures and societies around the world there is some long legacy of same-sex sexual behavior, or what we would call today gender non-conforming expression. The language of lesbian and gay is still not, or lesbian, gay, bisexual, and transgender is still not something that ought to be uniformly globalized, and many societies and many cultures. There's a rich diversity of names and histories. So already we have an issue with globalizing the identity of lesbian, gay, bisexual, and transgender, which is complicated. But there was this question that we all had to grapple with. This was true for HIV as well, about culturally, how can we do this work? People won't take amnesty seriously, or I don't understand, or we don't understand what this means to do this in our culture. And we really had to unpack that and stand on firm human rights ground, and basically say, look, human rights principles apply to everyone without fail, and that means that everyone has the right to be free from being targeted in the streets, or free from marital rape in the home, or free from torture, or intervention by police. And everyone has the same rights to assembly and association and expression. We had to grapple with a lot of different kinds of questions because the resistance came from from everywhere in different ways.
So yeah, I mean, just in short, I mean, not radical at all, right? What we were doing, really not radical. These were traditional human rights issues. That's all it was. It was just the naming of certain populations that had not been named before. And so the question is now, we at that time, those were the populations we were thinking about, but now we're still dealing with these issues, right? The question is, who now is not named? And who now are the people that one doesn't want to give attention to because of the fear of discrediting, et cetera. And I think people have been paying attention to, very recently, Amnesty has taken a position on decriminalization of sex work. And it's gotten a lot of pushback, even within the New York Times. And the thing is, I mean, I'm just gonna say quite clearly, we're back to this, what was happening back in the work that we all were doing, right? So we're back to the sense of traditional human rights. We're looking at human rights issues that are relevant to everybody, but what we're talking about is naming populations, and in this case, we're talking about naming people who have sex for money. And as a result, the issue is that we're hearing the same sorts of arguments now that we were hearing then. And it's really interesting in terms of just kind of being in the position of kind of think about organizing for this panel, and at the same time realizing kind of some of the issues that are happening now, and making parallels that maybe we would not have made in our brains if we weren't in the process of kind of trying to do this work at this point.
Great. Thanks.
Should I do this? Okay, one of the things that I think we're all really conscious of, that I think we all feel like we need to say, is that we're really clear that as a panel, this is not a diverse panel, and that we're really clear we're a bunch of white women sitting up here, and that it's just like we're like passing notes back and forth amongst ourselves, like somebody needs to say it, I'm just saying it. We're really conscious of the fact that that is the entity of people that are sitting up here on this panel, and we want to, I think, explicitly name it.
Good.
Okay.
And just to say something on that though, that we were meant to have a man on this panel as well, but unfortunately he did not get his visa in time. So there was an attempt at gender diversity in some small way, but unfortunately there was conspiracy against it.
I guess the other thing that we've been very concerned about or trying to be attentive to is that as we talk about this, to say, this is meant to be the inspiration for our activism, that the resistance and the difficulty of the work is the challenge that we take on. And in that, along those lines, I want to give a shout out to the 3 Amnesty activists who are in the room. We all did the work that you all are doing, and it's great that you came.
And we'll be passing around the fundraising button.
Brilliant, thank you. So I want to pick up actually on Sophia, where you were just talking about who the populations are that remain invisible. And again, one of the things that jumps out to me is that when we started this panel, we were talking about lesbian and gay concerns. We then realized that actually we were talking about men who have sex with men. And so it was framed more broadly, but targeted more narrowly, it would seem. And I wonder if you can speak a little bit about how that work created some sort of foundation which then allowed the work to become broader, there was this shift then to the language of LGBT, and then beyond that to sexual orientation, gender identity, gender expression. And I wonder, maybe Cynthia, if you can take this on and just say a little bit about how you think that your initial work really kind of laid a foundation for those shifts to happen.
So for those of you who, who've been following these discussions either within the US or outside over the last decades, you know that the language shifts, right? The language has really, it has shifted. I mean, God, the movement here was the gay liberation movement, right? Does that sound, do any of you remember that language? Let's start with that. So, over decades, the language around sexuality and rights claims has shifted. For us, again, we've heard about starting with the HIV Homo Task Force, and the first policy resolution on an international level that protected individuals arrested, in essence for being gay, did not use the language of being gay.
And in fact,
right. Yeah. So there's more to say about the language and the compromises that that we all, not like we're a big all, but a little all, the compromises that we made. But I think for us now, it's important just to look back about how some of this evolved. As Laura noted, initially we're using language of homosexuality, then we're using language of lesbian and gay, then we're adding bisexual, and then this was at a time when, this is about the social movements and social struggle. It became really clear that the language literally, we had to be expanding across borders within Amnesty around transgender identity. There were trans people, being arrested and targeted in many countries. The violations were coming clear, and the language had to adapt to what we were learning of the violations. I think that now, just making a little bit of a leap in terms of some of the UN work that we're all doing now, there's in my universe a lot of language around sexual orientation and gender identity, and using the acronym SOGI, S-O-G-I, rather than LGBT. In part because of what I mentioned and others mentioned before, that cross-culturally, LGBT doesn't always work so well. And as a matter of respect and authenticity, some of us believe that using SOGI wherever possible gets at some of that maybe not necessarily very effectively or smoothly, but it speaks to this question about what does it mean to globalize an LGBT identity and the struggle with that. Now, obviously, we hear so much more about intersex identity and violations targeted at, in particular, young kids, infants, and younger people, and that issue, also becomes complicated, meaning that there's a similarity when young people are targeted for medical intervention without their consent, and sometimes even without the consent of their parents, when doctors are making determinations, or families. When kids are born with atypical sex characteristics, right? In many circumstances, it'll be people from the medical community or sometimes families who will make a determination, and they'll say, just pick. They'll say, in the context of ambiguity, they'll say, okay, assign maleness or assign femaleness. And as these kids, as kids grow up, they may not grow into what's been prescribed for them. So there are a lot of, maybe not a lot, that's probably not fair, but increasingly within the UN system, there is commentary coming from special rapporteurs and some of the treaty bodies around what it means to have forced medical intervention of that type. So there's a parallel in terms of sexual orientation and gender identity, but it's also not the exact same thing, right? So we're also in this universe in which the acronyms are ever expanding, but it's sometimes a loose and inaccurate linking. And really what we're talking about is bodily autonomy, independent decision-making, bodily regulation, where the state or religious authority or medical authority dictate what's normal, abnormal. And I think part of the question that we struggle with now is how to maintain accuracy, but also cast a wide enough umbrella that we're speaking to those bigger questions of bodily regulation and often state intervention.
Thank you. Ali, do you want to?
Yeah, no, I think that's, this question, and it was asked a long time ago, and I think it was Carol Vance, who's a medical anthropologist, said, is it possible to deconstruct and defend at the same time in regard to the organization of identities and practices? And part of what's interesting about working within human rights is it's a language of global and universal, but does it have to have all the same categories to which all these universal rights are applied? And that's part of what you heard us struggling with in the late 80s, early 90s, and I think Cynthia's description is reminding us that we are still struggling with the way in which sex and gender systems, right, which are connected to but not the same thing, each other, right? The regulation of gendered practices and sexual practices are connected but not identical. They are deeply connected to other sets of axes of power, how people are organized by race, how they're organized by class, where they're understood to be within other social hierarchies also determine the appropriateness of your sex and gender roles, both in intimate partnership and in social organization. Given that, how does a human rights language come and intersect, right? And that, I think, is, and so when you hear this sort of endless litany of new acronyms or new movements, or it doesn't happen here, part of the question for many of us was, okay, what I'm describing as a gay identity doesn't happen here, but how does somebody get the ability to determine the meaning of their body and their sexual practices in ways that are relevant and connect them in the ways that they want to other ways of being, right? And what can human rights do to support that those forms of decision making? Now that moment is a radical moment, right? Because in every society and culture, organizing your sex-gender system to serve kinship systems, resource systems, how people get the benefits of the organized system of power, it's a really firm axis of organization. So saying that people have the ability to determine other, to be outside of, is the most radical fact. But that's always been the radical practice of rights, to the extent that rights is about that, right? So in a way that's for me the interesting thing is it's both the inherent radicalism of rights to say people can be self-determining, not isolated, not autonomous, not liberal end players, but heavily embedded in their communities, but making decisions with and for themselves and with others about meaning that I think human rights has been, it was, I think, intended for, but which we periodically fall away from when we fall into different tropes of what's protected under law and what's not protected, right? And that's where it's not just human rights' turn to health that's been interesting, but human rights' turn to law, because law wants categories, right? And so in a way, health is more productive of allowing diversity, but law can be less productive. So we're in a place of like nonstop tension in doing this work. And I think that's okay.
Susanna?
Yeah, just to add one more piece, or two more pieces. One is that I think that what's really interesting now is that SOGI is having an E added, which is gender expression. And that, I think that's a very important way of recognizing, in fact, the kind of gender sexuality spectrum and the way in which rights attach to that entire spectrum, so that, for example, seeing that people who face human rights abuse because of their non-conforming gender expression need to be kind of taken in and encompassed by the broader work around sexual orientation and gender identity kind of within human rights and more broadly. And I think so that's, in a way, that's the deconstructing and defending at the same time. To me, the other kind of deconstructing and defend, like that, the deconstructing and defending at the same time, was also that, somewhat parallel to this whole discussion was the emergence of a discussion that was explicitly around sexual rights or sexuality-related rights that was, kind of standing at the intersection between women's human rights and LGBT rights, and trying to say, can't we construct a language and a set of practices that is in fact broader? And I think my sense is that that has been more easily, though not easily, taken up by women's rights and actually sexual and reproductive health and rights organizations than by LGBTI movements. I mean, and folks are welcome to disagree, but that, I guess from where I stand, it's been kind of interesting who is more open and who's less open and why.
I just wanted to make a couple of historical comments. And one thing is, I think we also have to remember kind of when this work was starting, there was within Amnesty at the same time a discussion of whether Amnesty should work on issues of human rights violations by non-state actors. So, I mean, this is like an old land of human rights where really it was just about the state. And that's why we had to, I mean, I remember when we did the Breaking the Silence report, which is our first 1994 report on the issue, we basically had to go back through Amnesty's archives and just pick out cases that had already been reported on. So they had to fit within Amnesty's very clear structure, and they had to be these traditional human rights violations. And I think that the work was radical in the sense of it was forward-looking in insisting that not only did we have to look at non-state actors, but the state's impact in the private sphere, both in the positive and the negative, just sort of looking at all of those issues around how things are constructed and how power is or is not constrained by human rights law. I think at that point was very, very important and interesting and complicated. And also, as I think Ali already noted, in terms of queer theory, there was really very much an interest in sort of thinking hard about how identities and the economy, particularly sort of late capitalism, how they related to each other. And I think we were trying to figure that out with human rights as well. So that's one piece. And then the other historical piece that I think is really important, again, is I think because our first sort of requirement was to find these cases for Amnesty, and the researchers really didn't know how to do it because they weren't in touch with LGBT groups anywhere. So they were sort of saying, well, we've asked the Argentine human rights whatever, and they don't know of any cases. And so we had to kind of go to the LGBT groups and say, can you give us cases? That piece of kind of realizing that you have to have proximity to the groups on whose behalf you're claiming to speak. Again, I think the human rights movement has really changed in the past 25 years on this. But at the time, it was very unusual, and there was a sense of it was about Amnesty in London, looking for cases and talking to their counterparts. And I think that idea that it was actually much more about a permeable relationship of collaboration and thinking of human rights organizations not only as these kind of traditional groups, but also LGBT organizations, indigenous rights organizations, et cetera, et cetera. I think that was a somewhat new thing as well.
Thank you. Okay, I'm really conscious of time. I'm going to ask one final question because I can, and then I will open it up to other people. And Sophia, let me target you with this. So, a lot of the work that you've all described is it can very clearly be framed as advocacy in many ways. And I look down the panel, and many of you are now in academic institutions. And you're still working on a lot of the same issues around sexuality, around gender, around rights. Yeah, and so I just wonder if you can speak a little bit about how you see the connections between the work that was started at that time and the work that you're doing now, and maybe something sort of more broad around the different avenues for doing this kind of work at this moment in time.
Sure, I'll start. Okay. I think it really depends on what one calls advocacy. And I think that it's very clear in terms of the Amnesty work that we were working from inside. We were within the organization, and the language of advocacy within Amnesty is really comfortable. And so the fact of advocating for change within an organization that's about advocating for change is actually a comfortable place to be, right? Whereas advocating for change in terms of what a government is doing, in terms of kind of what different larger institutions are doing, is something that can sit kind of comfortably without a lot of pushback from the people that are kind of around you. I think being in an academic institution is different. And I do, and I think that one of the things that's important is this fact of, in the university where I was before, we couldn't even call or say that we did advocacy at all, right? So the issue has to do with what is objective and what is it that we teach in terms of skills and evidence and all of those different pieces. Am I less of an advocate than I was? No. but do I frame things differently? Am I conscious of how it is that I talk about things? And is it clear that, I'm really clear that I need to have behind me before I can make a claim, a conceptual framework that others can understand and that I can engage, that I have data or an ability to call out gaps in data, it's a different way of being able to do it. But I think I think for all of us, we sit in different places within this panel and people in this room, and we all sit kind of in different places. So, I think that the language of advocacy is interesting because I've become very nervous of the language of advocacy to define what I do. Mm-hmm. And it used to be that it was language that felt very comfortable, and I think it has to do with where one sits and how one works. And I think the last thing I'll say about that is that what I intend to do is to be able to work with generations of younger people to be able to give them the skills to determine the issues that matter to them and how it is that they want to work on those issues. And I hope that that is a different, that's a comfortable place now in my current world of using the language of advocacy.
Yeah, just to add to that a little bit, because I did just spend 7 years working for the UN Development Program. And I came to that work from decades of being an activist and entered it kind of nervously because I didn't feel like I could ever leave my activism and my advocacy behind, because it also is the expression of my passion, what's important to me in my life and in my life's work. But I think much like Sophia just said, I had to talk about it as technical expertise. And so I would work with governments in different parts of the world and bring my technical expertise to them. And unfortunately, there was, by 2008, that evidence to back up what are essentially, kind of in some ways, our advocacy arguments about the importance of addressing key populations at highest risk of HIV, the importance of making linkages between HIV and gender-based violence, and in addition, doing that in a way that very consciously created space for civil society organizations to talk to their governments, because in the end, I could enter in as the technical expert and introduce the issue, but in the long run, what would really make sustainable change would be to create relationships. So, kind of, the language, you craft the language to the place where you are, but, in a way, it's no less advocacy. It is also technical advice. Fortunately, we can do both and.
That's good to know. Thanks. Okay, we have a few minutes left. I'm going to open it up for questions. John, would you like to come and join our panelists for our Q&A? And you might need to get your turn. And does anyone have any questions for our panelists?
Yeah, let's I really appreciate all of you being here, and it was fascinating. I really learned a lot. When I saw the advertisement for the lecture, I assumed it was going to be about women's health and women's rights. And so I thought it was sort of interesting listening to Susanna speak about this bifurcation between the LGBT and the women's rights, because the discussion and the title are really focused on the LGBT side. And so I wonder if you think that's sort of emblematic of what you were describing, this historical shift, and is it therefore sort of embedded?
There's advocacy taking place.
Football rally.
It's nice to know that you're as vibrant as advocacy.
I think that all of us here both recognize that there is some bifurcation, but that's really false. So for myself, the work I do around sexual orientation and gender identity is very much about a kind of a vision or an ideological commitment to thinking about gender and sexuality as key axes for doing human rights work and doing advocacy. So I think there is some bifurcation. I was just thinking about this first. I mentioned the UN governing board resolution that mentioned LGBT. But unfortunately, what it actually said was that the work on gender and HIV was going to be interpreted as work on women and HIV, and that the LGBT work should happen, but as separate strands. So, and that for me was, I kind of saw that and I thought, I can't do that. That, in a kind of fundamental way, those are all about issues of gender and sexuality. But I think that we are always faced with a lot of resistance to having that kind of integrated, or even more so, intersectional approach. And whether that's gender and sexuality, or race, or caste, or, kind of the various axes of, discrimination. I think that that we are always faced with a kind of tension to separate and a tension to pull together.
So actually, sorry, a quick additional comment. I'll make this quickly. LGBT and LGBTI and SOGI, SOGI, and SOGI, SOGIE. That work is intimately connected to the universe of women's health, women's human rights. I think all of us, are deeply connected to women's rights advocacy generally. But let me say this, that part of the struggle that I think we all have is that within LGBT communities and advocacy and within that work, there is a huge struggle to address women's rights under that LGBT umbrella. We were talking yesterday about, there's a level of sexism in the analysis and the invisibility in the omission. And at the same time, there's still a struggle within women's human rights organizations, women's rights organizations, movements, advocacy, to grapple with issues of sexuality, sexual orientation, gender identity. So there's blindness and work to be done to unpack the ways in which our movements are not, they're not yet good enough about recognizing who's not at the table, who's not being privileged, whose human rights concerns are not being articulated or voiced, and I think we all still struggle with those questions.
Yeah, Doug.
This was terrific and a fascinating way of sort of thinking about the history of how change happens in these contexts. And so much of this was about language and the evolution of language and how language has changed. And I feel very sad about the loss of the word advocacy. I'm very concerned about the new language that sort of mitigates it into technical assistance. I understand it, I live in this world as well. But I wonder, if there's a way to find another word that would strike more at the heart of this and more at the passion of this than these sort of broad technical words that, at least for me, are not a good idea, not pleasant.
Yeah. Can I say, I work at Yale, and among universities, Yale has a long history of being, it had an interesting history in the 60s, and then it has had recently a very long history of very political quietness, right? And so what was fascinating to me is in building our program jointly between the law school and the public health school, what both deans were very interested in is the way in which health is a site at which in the inequitable distribution of disease is so absolutely apparent, and the way in which huge systems of legal governance can be altered to make things more or less fair, that they understood, and the reason for our title was Global Health Justice Initiative, that we were in fact organized to do work toward justice. So that it is a program, but both deans understood, was about a justice intervention. And they knew that in hiring myself and my co-director, Greg Gonzalez, and I'm on faculty as well, we have long histories of advocacy, and that was not to be left behind. And for Yale, it was very interesting, because that connection between the university and intervention into injustice has not been the practice of those schools in a big way. So I was very pleasantly surprised by the willingness of the schools to move into that realm, and both deans to support that as the way in which we are going to organize. We do a clinic where we train law students and public health students together. We set that clinic up as connected to social movements, because that's where we understand our accountability to be in terms of making change. And we train in that mode and have been remarkably supported. So I actually think we're in an interesting place in different moments and different times to actually reclaim the work.
Just to be really clear, however, the restricted terminology was very much about working at the UN Development Program, which very explicitly says we are not an advocacy organization, right? So, so it was about finding a way of doing advocacy in a very constrained environment, and in fact, that the UNAIDS, the UN Joint Program on HIV, actually has a lot of space to do advocacy, and that's kind of written into their mandate. So, and as that technical expert, what I tried very hard to do in a country is to say there's tons of advocacy. There are movements that need support, and that's what should happen there. And my role, the kind of convening role, is to help broker those relationships, which is not to say there's no advocacy. It's to say I, at UNDP, have to say what I'm doing is technical expertise, and that's what governments will want to hear. The moment I left, I reclaimed the persona of activists and advocates. So it was temporary.
And the only thing I'm going to say is that I'm still new here. And so if there's an interest within this university for that language, let's have a conversation, right? So,
Well done.
I was just going to add the sort of governmental role. We as a city are able to fund certain things like social services or cultural programs, but we may not be able to fund advocacy work because that's viewed as political, and we're not supposed to be using government funds for political work. But we are able to fund what is effectively advocacy by using a little bit of a wink and a nod and saying, okay, we're funding a cultural program for the trans community, knowing that full well it is really about organizing and advocacy on behalf of a marginalized community. And we can do the same thing with some of our immigrant communities by funding cultural programs that help them build community so that the advocacy work can be done.
Thanks. Okay, we have time for one more question.
So I'd like to pick up again on this idea of language and how we frame even what is a human rights violation or issue. And so I'm wondering, kind of picking up on what I think Meg said about non-state violators, how your work is addressing kind of these other systems, domestic or international, that kind of restrict people's ability to access resources that allow them to live and achieve a certain level of well-being and health. So I'm thinking about the healthcare as an institution and employment as being two areas that particularly affect the transgender community in terms of their ability to access those things that just sets them on this downward spiral of marginalization and disadvantage. So I'm wondering how your work is potentially addressing these things.
Okay. Well, I'm just going to first do what we should have done at the beginning, which is to thank our hosts, and I really want to thank the Institute for Global Health and the Program on Global Health and Human Rights, and specifically also Sophia Greskin. So thank you. I think this has been to that point, this is to be very brief. So I teach also a clinic. I love the word advocacy. I actually teach students to be advocates. So that's because I'm in a law school. But one of the things that my clinic does is specifically doesn't use the word human rights in our title. We're called the Global Justice Clinic, and the point is to ask the question, can human rights actually meaningfully engage with global justice? Meaning, can we actually make a change in people's lives by engaging in human rights work that really looks at powerful institutions, and it's not always the state, right? Like often it's international financial institutions, corporations, et cetera. So I think it's a really important issue and question, and I think the human rights movement has come a long way in really finally engaging that set of questions, but the answer is not always yes, I don't think.
yeah, the only thing I want to add, and thank you. I'm going to cry if I talk, so okay. But the only thing I would say is that in terms of thinking about not only working around violations, but about how to integrate rights into programming, how to integrate rights into doing work to prevent violations from occurring in the first place, which is a lot more, I think, what a lot of us are also engaged in now. And so I think that there's activity now to be able to try to move in that direction. I think all of us could actually speak to that from the various places that we are, but it's not enough. And it needs a lot more from a lot of different places.
Susanna, final
No,
word.
because I think that, I think that part of what's happened is also that the kind of lexicon of human rights norms and standards have in fact come along too. They're not where we want them to be, but in fact they are very much further along now than they were 20 years ago in recognizing the kind of structural factors as part of what are human rights concerns.
Well, thank you again. I actually want to thank all of our panelists. You've done a phenomenal job. I just have a couple of things that I want to say in closing, and I'm going to be super brief because of the time. This panel, the idea for this came out of the fact that there was a recognition that this is an important story to tell. There's an important political history here in terms of the movements and a lot of, I'm going to call it definitely groundbreaking, even if you guys didn't go with radical, a lot of groundbreaking work that this was. But I think that what's really come out across the panel is this trajectory from that history that brings us to the present and also looks to the future as well. And I think it's really important to consider how the work that's happened has set up work that's yet to come. And one thing that really resonated that Cynthia said, you talked about, we said we had nothing but the knowledge of the truth. And I think that that idea of the knowledge of the truth is incredibly powerful and can really be a useful basis for continuing to move forward with this work. So I just want to thank everyone.